so much for joining me for another episode of 10 Minute Tuesday. If you haven't already, please like, share, and subscribe. In today's episode, I got Michael McCusker in the building, Tableau tech lead from DaVita. What's going on, man?
Hey, Sicker. Thanks for having me.
Yeah, likewise, man. Thanks for taking time out to be on. So we've done a number of these. Michael, let's go ahead and dive into it, man. Go ahead and introduce yourself to the people.
Yep. Well, hello, everybody. My name is Michael McCusker. I am a Tableau tech lead for a company called DaVita. We are a healthcare company that provides dialysis for patients with kidney disease. And I learned just at the start of this call that Seku's wife also works for DaVita. So small data world, small healthcare world. And DaVita was actually my first data job and my first job here in the US. I used to live and work in the UK. Back there, I worked mostly in kind of public records, births, deaths, marriages, that kind of thing. And me and my husband, we moved to the US back in 2012. And when I first came over, I was on a spouse visa, wasn't allowed to work for a little while. And so a bit of a career break, a bit of career change, and now I'm in data at DaVita.
Love that. So really that gives me into the next question, right? So you're from UK, came over, I love America, San Diego's beautiful. I love it. Oh, it's amazing. The sunshine's great. What am I going to do to get into actual data? What am I going to do? So, thinking about that, what actually compels you to get into data to begin with?
Yeah, so when I came over, I had this opportunity where I wasn't working for a little while, so I went back to school and I studied math and physics, something I always kind of wanted to do. And just as I was finishing up my degree, I'm looking at things that I might want to do afterwards. And we're getting towards the time where my green card's coming up, so I will be able to work in the future. And whilst I'm still a student, I get a student license for Tableau. And this is my first time using Tableau. And I kind of fell in love with that tool. So Tableau kind of came before the data job. And I was like, hey, I wonder if I could do this as my job. And then we moved to Denver. And for a couple of weeks in Denver, we were just in some temporary accommodation in this high rise apartment. And every morning I woke up and I opened my curtains and DaVita was there. And I didn't know what DaVita was or what they did, but a few months later, I'm looking for a job and DaVita came up and I thought that's that company I saw every single morning. They're wanting someone to do Tableau. And so I applied and they took a chance on me. I was super green. I'd never worked in data before, but I was excited, committed, and I had this fun story about opening my curtains every morning and looking at the office building, and they bought it, and yeah, I've been on that team ever since. This is my team, clinical analytics and reporting. A really great team within
Awesome.
DaVita.
Hey, shout out to the team, clinical analytics reporting. That's awesome. So are you in Denver now or are you in San
No,
Diego?
we moved to San Diego a
Okay.
few years
Okay.
back. I joined DaVita during COVID, and the idea was that I would work for the Denver office, but things changed. I did it remote, and
Yeah.
they allowed me to move to San Diego when that opportunity kind of came up. So another kind of call out and kudos to them. So
Okay, cool, awesome. I just want to make sure because I was saying San Diego, and I was like, wait, is he in Denver?
yeah, yeah.
All right. So there's a philosophy I love to live by. It's the concept of failing forward, right? So everything you do is a lesson. Like nothing that you do is for, no gain, right? So every time we take a bump, it doesn't feel good. We learn something from it. So thinking about that, what would you consider your biggest failure, and what did you learn from that experience?
Yeah, I love it when you ask people this question because nobody likes it.
Yeah.
But you're right. We all experience it. I think as data analysts, like, you sort of pride yourself on being accurate and dependable. And when any of your work isn't, it kind of you get that horrible feeling in your stomach, and you just feel like you've let people down. And unfortunately, you're never not going to experience that. And so it's kind of like how you deal with it. And I think my example here, I don't want to use a data example because it's kind of too close to what I do just now. But back when I was working at registering births, deaths, and marriages in the UK, I had joined this new office, this new city. I just moved to the city and I could already do the job. I was doing the job in a different city. And I said to them, hey, can I come and work for you? I can already do this job. And they said, yeah, well, come, we'll try you out for a little while. And so I'm determined to prove myself to them. I can do the work, but they have different people, different processes, that kind of thing. And I'm doing an appointment with death registration, and those can be stressful at times. And whilst I knew how to do the job, I didn't really know how the office worked under certain circumstances, and I kind of made a mistake. And I got out of my depth and I didn't handle it correctly. So, although the registration went well, the appointment didn't. And all because my pride got in the way of asking for help. Um, and they said, all right, so maybe you're not going to work for us for a little while, but we're going to send you to our sister office at the coroner's office. And I ended up working there for a couple of years. And that wasn't the plan. And it was kind of a bit of, I don't know if it was punishment or um, but I kind of still kept in touch with those people, and I would do overtime work with them on the weekends. I would go and do marriage ceremonies for them. And then a couple of years later, a job came up there, and it was a big promotion for me. It was the job that I'd always wanted in registration. And the experience that I'd gotten at the coroner's office was what made me stand out. And then I got that job at the company or at the office that let me go. So it wasn't the plan. My pride got in the way, and I made a mistake. But I rolled with the punches. I didn't give up, and it ended up working out well in the long run. So,
Love that. Love that. So it's always fascinating when you look back on it. It's easy to talk about it after you look back at it, but while you're going through it, it's like,
oh, hated it.
it's awful. It's
It
awful.
was so sad. Yeah, yeah. But it ended up working out really, really well for me. So,
Great, great, great. Love that. So you're really like a great audience for this question because you didn't start out in data, but then you pivoted. And my target audience for this are people who are either trying to transition into data, get into data, or they just like me ramble on this podcast. So with that in mind, what is one piece of advice you give someone who's just starting out in their career?
yeah. So if you're already in a job, and you already have that job, you've done the hard bit because interviewing right now is kind of crazy. It's really tough for a lot of people. But if you're in a position and you're trying to kind of stand out, I would always recommend connecting what you're doing to the why. Because as data analysts, it can be really easy to sort of get a list of requirements and then work by yourself, build your dashboard or pull the data, and you can be disconnected as into the reason why you're doing it. And for me, I always wanted to work in healthcare because I'd spent some time in hospital, and I'd also worked in hospitals a little bit in a clerical role, and we would take our services to the hospital. And I was always really in awe of the people who worked there. And I knew I could never do it. I could never be a doctor or a nurse. It's not like I'm not that kind of sort of superhuman that those people are. But I wanted to know, can I help them? Um, and DaVita felt like a good fit because they claimed that like the work that you were working on like directly helps the people who are caring for our patients. And after a little while, you forget about it. You joined another Zoom meeting, another Teams meeting, or you built another dashboard, and you forget that the work that you're doing has a direct line to the patients that we help serve. So one of the things I always have our analysts do is visit the facilities that are providing dialysis care. And the first time I did that, and I walked in, and within 5 minutes, I saw one of my reports up on somebody's screen, and it just made the connection, and that just really worked. And that really, it just sort of like um, it gave me a great deal of satisfaction, and kind of felt like what I was doing mattered. And I think it works in any industry, whatever you're passionate about, as long as you don't lose sight of the end, then that's my recommendation. And you just start to connect things better. If you know the why or you know the whole path of what you're working on, you just understand things a little bit better and you don't become disconnected from the goal.
Love it, love it. Great reminder for me too, especially in the season I'm in, that everything should be connected to a why, right? We're not just putting numbers and stuff on paper and making pretty charts and visuals, there should be something tied to it. And as I said before we started recording, I worked at DaVita as well. So I did a dialysis visit, and it's just like, whoa, like
Yeah,
there's
it's
real
intense.
life happening. But then if you're able to see reports of different things, like how you're making an impact on someone's life, who the people who are really like the nursing staff, they're really working really hard. It puts in perspective how you can help them out. So thanks for that. Thanks for that reminder for me. This is great, man. This is awesome. All right. So tell me about the most influential people in your life and how they made an impact on you.
Yeah, I'd love to have an answer where it's like some philosopher or some some mentor that I had earlier in my career, but it's not. It's just people that I've worked with. When I worked at the coroner's office, that's a stressful job. You're dealing with people who have lost loved ones, and they're having their worst day, and you're meeting them on their worst day. And kind of what gets you through that is your colleagues, and the people that you work with. And we had a great team. And people are always surprised to hear me say that working at the coroner's office was a whole lot of fun. And that was because of the team that we had. And similarly, in my kind of first job, I kind of made friends there, and they kind of taught me the importance of like a good work ethic, but not they didn't sit me down and teach this lesson to me. They just led by example. And along the way, like these are people that I've picked up and are friends, 20 years, 10, 20 years down the line. And so they're kind of like the most influential people to me in my kind of career. Just people who are doing the job, doing it well, and make it a better place to work by just being there.
Love it. Love it. Michael, you're dropping so many great gems, man. This is phenomenal. So thanks for being on and being awesome. Where can listeners find you at online?
So I post a lot on LinkedIn and Tableau Public. That's been my goal for 2025. So I've just tipped over on my like 1 year of trying to be more engaged with the Tableau community. So that's mostly where I post things. I have a blog coming, but I keep procrastinating on that one. So mostly Tableau Public and LinkedIn for the
Awesome.
moment.
Find them on LinkedIn, Tableau Public. I give a shout out to the San Diego Tableau user group. So if you're looking for your tugs to join, shout out to San Diego. They're phenomenal. Michael, appreciate you being on, man. Today was great.
Yeah, thank you. I
No,
really appreciate it.
yeah, no problem. No problem at all. Yeah, likewise. And as I said in the beginning, if you haven't already, please like, share, and subscribe. And we'll talk to y'all next week. Have a great day.